there's a lot of advantages to a telehealth visit over an in-person visit, notwithstanding the not having to, reducing, patient to patient or doctor to patient, physical interactions and the closeness for the potential for the spread of virus. But it is actually a lot more convenient for patients. So let's think about it. Normally, when you go see the doctor, you start packing up, you jump into the car, you're driving it right through traffic, and you have to go through a couple crazies who are on the road, as there always are, finding a parking space, walking in, checking in, waiting for the doctor, who, us doctors don't really have the reputation of always being on time. I think that's a little unfair. We do a pretty good job these days. It's a reputation we have had a hard time shedding. But nonetheless, it's a big deal to go to the doctor. Through a telemedicine visit, certainly when it's your turn, you log onto your computer or even smartphone. There is going to be a check-in process that goes on, and there is sort of a virtual waiting room. You're in the comfort of your own home. You can have a cup of tea. You can be, reading your own magazines rather than the magazines we have here in our office. You get the visit done. You have a nice interaction. The doctor is still able to order whatever labs or x-rays that they would have been able to do face-to-face. And when you're done, you're already home. So really, there's a lot of conveniences, and which I think is a lot better for a lot of patients. There's just so much hassle sometimes getting to the doctor, that if a telemedicine visit was able to be used in lieu of a face-to-face visit, it was more convenient for patients anyways. Certainly, this has exploded because of the need to reduce patients coming into the office, reduce healthcare workers potentially exposed to one another, to patients, or patients exposed to us, or patients exposed to other patients.